Welcome to Pulse Medicine, muscles of the head, face and neck. Now, we are going to look at the muscles of facial expression, muscles of chin and swallowing, muscles of the neck, hyoid muscles, suprahyoid group, infrahyoid group, scalene muscles. Now, let's start with muscles of facial expression. Orbicularis oculi is the muscle that surrounds the eye socket and extends into the eyelid. Its attachment it originates from the medial orbital margin and the medial palpebral ligament and the lacrimal bone. Now, its functions it include palpebral part, which gently closes the eyelids, lacrimal part involved in the drainage of the tears, orbital part it tightly closes the eyelids. Its inversion is temporal and zygomatic branches of facial nerve. Now, its general function it controls the movement of the eyelids and it's important in protecting the cornea from damage. Nasal group are associated with movement of the nose and the skin around it. Procurus is the most superior of the nasal muscles. It also lies superficially to the other facial muscles. Its attachment it originates from the nasal bone inserting into the lower medial forehead. Its function contraction of the muscles pushes the eyebrows downward to produce a transverse wrinkles over the nose. Its inversion it includes the facial nerve. The second muscle is nasalis. Is the largest of the nasal muscles, split into two parts, transverse and alar. Its attachment both portion of the muscles originate from the maxilla. The transverse part attaches to a aponeurosis across the dorsum of the nose. The alar portion of the muscles attaches to the alar cartilage of the nasal skeleton. Its action, the two parts have opposing functions. The transverse part comprises the nares and the other alar parts opens the nares. Proprioceptive. These muscles assist the alar part of the nasal in opening the nostrils. Oral group. This is the most important group of the facial expressors responsible for the movement of the mouth and lips. Such movements are required in singing and whistling and add emphasis to vocal communication. The oral group of muscles consists of orbicularis, oris, bassinator, and various small muscles. Bassinator. This muscle is located between the mandible and maxilla, deep to the other muscles of the face. Attachment it originates from the maxilla and mandible. The fibers run in an infromedial direction, blending with the orbicularis, oris, and the skin of the lips. Its action, the bassinator pulls the cheek inwards against the teeth, preventing accumulation of food in that area. Orbicularis oris. The fibers of the orbicularis oris encloses the opening to the oral cavity. Attachments arises from the maxilla and from the other muscles of the cheek. It inserts into the skin and mucous membranes of the lips. Its actions possesses the lips. Inversion, facial nerve. Now, there are other oral muscles that act on the lips and mouth. Anatomically, they can be divided into upper and lower groups. So, the upper group contains the risorius, which is responsible for the lateral movement of the mouth. Example, it is found around the lips. It closes the lips, responsible for whistling and kissing. Now, the lower group contains three muscles. Pressor labial inferior originate from oblique line of mandible and insert in skin and submucosa of lower lip. Its blood supply is by inferior labial branch of facial artery, middle branch of maxillary artery. Nerve supply is by mandibular branch of facial nerve, and its action is to depress lower lip inferior laterally. Next one is depressor angulioris. It originates from endotubercle and oblique mandible. It is a continuous with platysma muscle. It inserts into mediolus and its action is to depress angle of the mouth. Blood supply is by inferior labial artery, mental artery. Nerve supply is by buccal and mandibular branches of facial nerve. The next muscle is mendalis. It originates from the mandible and runs vertically from below the lower lip to the lower part of the chin. It elevates and everts and protrudes lower lip, ringo skins of chin. It is inverted by mandibular branch of facial nerve, inferior labial branch of facial artery, mental branch of the maxillary artery. Zygomaticus major, a muscle of facial expression which draws the muscle angle of mouth and superior and posterior to allow one to smile. Origin, it inserts in the mediolus of the mouth. Zygomaticus minor, it originates from lateral aspect of zygomatic bone and inserts into the outer part of the lip. It is inverted by zygomatic and buccal branches of facial nerve. Levator angulioris, it originates from canine fossa of maxilla. It inserts in mediolus. Its action is to elevate angle of mouth. It is supplied by zygomatic and buccal branches of facial nerve and superior labial branch of facial artery, infraorbital branch of maxillary artery. The next muscle is levator labii superioris. It originates from maxillary process of zygomatic bone. It inserts in upper lip and elevates upper lip, exposes maxillary teeth. Blood supply is by facial artery and infraorbital branch of maxillary artery. It is inverted by zygomatic and buccal branches of facial nerve. Muscles of mastication. The muscles of mastication are associated with movement of the jaws. Masseter. The masseter muscle is the most powerful muscles of mastication. Action, it elevates the mandible and closes the mouth. Now, temporalis. Temporalis muscle originates from the temporal fossa, a shallow depression on the lateral aspect of the skull. The muscle is covered by tough fascia, which can be harvested surgically and used to repair perforated tympanic membrane, an operation known as myringoplasty. Originates from temporal fossa. Its function elevates the mandible, closing the mouth, and also retracts the mandible, pulling the jaw posteriorly. Inversion mandibular nerve. Lateral pterygoid. The lateral pterygoid muscle has a triangular shape with two heads, superior and inferior. It has horizontally oriented muscle fibers and thus is the major protractor of the mandible. Its attachment, the superior head originates from the greater wing of the sphenoid. The inferior head originates from the lateral pterygoid plate of the sphenoid. Lateral pterygoids protract the mandible, pushing the jaw forwards, and lateral action produces side-to-side movement of the jaw. Median pterygoid is a major elevator of the jaw. Is a square-shaped masticatory muscle located on the medial aspect. Its attachment, it originates from maxillary tuberosity and the pyramidal process of palatine bone. Its function, depression and medial movement of the mandible. Muscles of chewing and swallowing. Two types of muscles here. We have extrinsic muscle and intrinsic. Now let's start with extrinsic. Genioglossus arises from mandibular symphysis, inserts into the body of the hyoid bone and the entire length of the tongue. Its inferior fibers protrude the tongue. The second one is hyglossus. Attachment arises from hyoid bone and inserts into the side of the tongue. Its function, depresses and retracts the tongue. It is inverted by motor inversion via the hypoglossal nerve. Third one is styloglossus. Attachment originates at styloid process of temporal bone and inserts into the side of the tongue. Third one is palatoglossus. Attachment arises from the palatine aponeurosis and inserts broadly across the tongue. Its function, elevates and posterior aspect of the tongue. Inversion vagus nerve. Muscles only attaches to other structures in the tongue. They are named according to direction they travel: the superior longitudinal, inferior to longitudinal, transverse, vertical muscle. So let's look at the muscles of the neck, their function and their inversion. Let's start with Suboccipital muscles. They are a group of 4 muscles situated underneath the occipital bone. All the muscles in this group are innervated by the suboccipital nerve. Now, the next muscle we are going to look at the rectus capitis posterior major. Is the larger of the rectus capitis muscle, originate from spinosus process of C2 vertebrae, action, extension and rotation of the head. It is innervated by suboccipital nerve. Second muscle is rectus capitis posterior minor. Is the most medial of the suboccipital muscles. Attachment, it runs from posterior tubercle of the C1 vertebra. Action is extension of the head. Obliquus capitis inferior is only capitis muscle that has no attachment to the cranium. It helps in extension and rotation of the head. Obliquus capitis superior is located laterally in the suboccipital compartment. Function is to extend the head. Suprahyoid muscle. Suprahyoid muscle are a group of 4 muscles located superior to the hyoid bone of the neck. Its function involved in swallowing. Arterial supply to this muscle is via branches of facial artery. Sternocleidomastoid. It's a thin muscular strip which is located superior to posterior belly of the gastric muscle. Its function initiates in swallowing action. Gastric. It comprises of 2 muscular bellies, the anterior belly and the posterior belly. Its function, it depresses the mandible and elevates the hyoid bone. Myohyoid. It's a broad and triangular shaped muscles. Its function elevates the hyoid bone and the floor of the mouth. Inversion, inferior alveolar nerve. It originates from the myohyoid line of the mandible and attaches onto hyoid bone. Myohyoid is located close to the midline of the neck, deep to the myohyoid muscle. Function, it depresses the mandible. Now, let's look at the infrahyoid muscle. The infrahyoid muscle are a group of 4 muscles that are located inferior to the hyoid bone in the neck. They can be divided into 2 groups, superficial plane, deep plane. The omohyoid is comprised of 2 muscles bellies which are connected by muscular tendon. Attachment, the inferior belly of the omohyoid arises from the scapula. It runs medially underneath the sternocleidomastoid muscle. Function, it depresses the hyoid bone. Inversion, anterior rami of C1. Sternothyroid. The sternothyroid muscle is wider and deeper than the sternocleidomastoid. It is located within the deep plane. Its attachment, it arises from the manubrium of the sternum and attaches to the thyroid cartilage. Its function, it depresses the thyroid cartilage. Inversion, anterior rami of C1 and C3. The next one is sternocleidomastoid. The sternocleidomastoid muscle is located within the superficial plane. Its attachment, it originates from the sternum and sternoclavicular joint. It ascends to insert onto the hyoid bone. Its function, it depresses the hyoid bone. And its inversion, anterior rami of C1 to C3, carried by a branch of the ansa cervical. You note that the arterial supply to the infrahyoid muscle is via the superior and inferior thyroid arteries, with venous drainage via the corresponding veins. Sternocleidomastoid. The muscles arises from the manubrium of the sternum and the clavicle, and extends upwards to the mastoid process of the temporal bone. It assists in turning the head from side to side. When the muscle on one side contracts, it draws the head towards the shoulder. When both contract at the same time, they flex the cervical vertebrae or draw the sternum and clavicle upwards. Scalene muscles. There are 3 paired muscles, anterior, middle and posterior. It's located in the lateral aspect of the neck. Anterior scalene is a muscle that lies on the lateral aspect of the neck. Attachment, it originates from anterior tubercle of the transverse. Function is to elevate the first rib. The scalene is the largest and longest of the 3 scalene muscles. It has several long, thin muscles bellies arising from cervical spine. Its function is to elevate the first rib. Posterior scalene. is the smallest and deepest of scalene muscles. Attachment, it originates from the posterior tubercles of the transverse process of C5 and C7. Function is elevation of the second rib.